Hi, all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcomed by Gloria Lau, who is the founder and CEO of Hello Alpha. Thanks so much for being here.
Hi, thank you for having me.
We are so happy to talk to you today about primary care solely focused on women. But you have a personal story behind this. So why don't you tell us a little bit about how you came to found Hello Alpha?
Yep, happy to. So I am born and trained as an engineer, no prior healthcare background. I had a couple of healthcare issues, one of which was when I had a women's health issue. I was bounced around in the system from primary care to OBGYN to, in my case, dermatologist and allergist. So through that experience, I got to see how broken it is. And I got to understand that, hey, primary care really doesn't work for women. So that's when I decided to quit Google, quit traditional tech, and went back to Stanford to explore what I can do to make it better. I say I went back to Stanford because I made consulting faculty in the engineering school. During that time, I met my co-founder in the medical school and started Alpha. So that's the beginning of Hello Alpha. And when I say my own experience with primary care that just doesn't work for women, it is because primary care isn't designed for women. It just doesn't work because whenever you go into a primary care provider as a woman, when you bring up anything that reminds them of the reproductive system, chances are you get an automatic referral to OBGYN. Now, when you get to the OBGYN's office after 30 days wait, the OB is not where you should be getting primary care from because they're not trained in primary care. So that's the gap that we're filling here.
I find that interesting, Gloria. I haven't thought about it myself either, that there is such a gap. And it's interesting to me in how you're filling the gap. You were describing a pretty detailed system of education and potentially training as well. Maybe you can talk a little bit about that in terms of how do you recruit the physicians that provide this need, and then how are you training them?
Yeah, definitely. So we employ our own PCPs. We recruit them, and it is actually like one of the things that work very well for us. A lot of telehealth providers struggle with recruiting during the pandemic. We had no such issue because our mission really sells us all, right? Like we are about affordable, accessible healthcare for women. We train our providers in women's health. So that really helps providers get a broader scope of practice. And our internal training program is called Alpha Academy. That's how we train our providers in treating women. So we train them in clinical knowledge. So things like PCOS. Actually, I don't know the full name of PCOS. Dr. Gupta can help me
Yes,
fill in there.
polycystic ovary syndrome. Yes.
Yep. So things like PCOS, menopause, obesity, or heavy bleeding, like all these conditions that happen in the women's body, right? Like we train them in managing these symptoms, both the physical symptoms and the mental health symptoms together. So we provide that type of clinical training in our platform called Alpha Academy. We also train them on the module of whole person care around, hey, like, what does it mean to provide whole person care? What does it mean to talk to someone who identifies as women, as female? What does it mean when you think about these things that happen in a hormonal system, right? Like when women complain about pain, when we talk about, heavy bleeding, when we talk about these topics that could be embarrassing, right? Like, how do you understand that? How do you talk to patients about them? So we provide both clinical training and also just like patient journey training to our own providers.
How important it is that to have the emotional aspect of this care and the validation, because you described that before we started recording. And then again, just now you alluded to that sometimes the things that female patients may be telling a provider aren't taken seriously or are dismissed in one reason or another.
Yeah, it is really infuriating that it's still happening in today's world, but you have so much literature documenting this, right? Like women, when you walk into a traditional healthcare system, oftentimes when we talk about pain, when you talk about bleeding, when you talk about all these things, we're not taken seriously. And that's the barrier that we're trying to break through, right? Outside of that, I would say treating the whole person, meaning your physical symptoms and your behavioral symptoms together. You also have a lot of literature to say that, hey, like doing whole person care, having a primary care provider to treat both your mental health and your physical health saves the system money, right? That there's a lot of good literature to suggest that yes, like you should employ this model, and that's the model that we're providing for our patients. Fundamentally, patients want to speak with the same person who understands both sides of the symptoms, right? And it helps the health system save money in the long run.
Normally, Gloria, when we've had guests who've talked about developing their own systems, and when we hear about whole person centered care type systems, I start to think, well, it takes a lot of time, and so that time is money, and therefore they wind up being pretty expensive. But you've developed what you call a very accessible and low cost program, which sounds amazing indeed. So maybe you can describe that platform a little bit in terms of the economics of it and how it works.
Yeah, fundamentally, our true north is to provide accessible, affordable care, right? That's what we do. And our pricing model is very simple. We are cash pay only. We don't bill through carrier. And we have a membership program and an a la carte program. We have two tiers of membership. The basic tier is $29 a month. That gets you access to most conditions. We treat 100 plus conditions on the platform. We have a membership plus model at $49 a month that gets you access to things like the chronic care around obesity, around mental health, things that require a lot of management, right? So $29 at the basic level, $49 at the upper level per month. The a la carte model is $35 per visit for most visits. So that's our cash model. Very, very simple, very transparent, no hidden fee anywhere for the patients, and they just come in and pay cash. And for most people, including myself, that's cheaper than a copay.
You've seen 400,000 plus patients, is what you mentioned. Is that business model sustainable, even though you're charging a fairly low amount on a monthly basis?
Yeah, we've done over 400,000 encounters. And when you look at the economics, right, fundamentally, we practice asynchronous telemedicine. That is a huge driver. And when we talk about asynchronous, that means there's no video component, right? There's no what we're seeing here. So you don't have to deal with like the scheduling and the no-show, whether it's in person or video. When there's scheduling involved, you have to deal with the no-shows, right? And the beauty with asynchronous is that we have patients complete a medical intake form at their own time. So patient Gloria, I think through my symptoms, my family history, everything on my own time. I'm not paying a provider to look at me when I think about those things, right? And think about the savings that you're having by having the patients complete that asynchronously. And oftentimes for patients can take multiple sessions, especially for really complicated stuff like mental health or menopause, they do take multiple sessions to complete just the medical intake forms because they're really intense. So you're not having anyone look at them. You're not paying for anyone look at them when they think about the symptoms, family history, all of that, right? Once they're done, all of that is automatically integrated into the EMR. And only then we notify our provider, their designated primary care provider, hey, a case is pending for you. Then they go into the EMR, they look at they look at all of the information available in front of them, and then they do their diagnosis, treatment plan, everything asynchronously through messaging. So that's the beauty of asynchronous. You drive huge cost savings, and I really believe asynchronous is the future of healthcare. I think video, meaning synchronous telemedicine, don't really have a room in the healthcare system. You really want to drive costs down, you really want to drive efficiency. And for patients, they prefer asynchronous, right? Like you don't have to find time in your busy day. For a lot of patients, they don't have the way to find a private space to chat with a provider, right? It is difficult, especially for more discrete conditions. Asynchronous really breaks down all of those barriers. I'm a huge proponent. I can talk about it forever.
Do you find that people might be more willing to share some of these issues through asynchronous? And on the flip side, does it sometimes take a few back and forth exchanges to get to what people are trying to really get the treatment for?
Thank you, Stephanie. That's very, very insightful. Sometimes it does take a few back and forth on the messaging to get through. And we always, like, we're learning, right? So we'll learn and figure out, hey, is our medical intake form complete enough? Is it smart enough? Does it ask you the right question? Does it have the right branch points, right? So we've evolved a lot on our medical intake forms to try to be smart and extract the right amount of information, gain the right trust with the patients. So that's how we build our system. And I do think in the long run, you're going to have And the other thing about asynchronous is that you standardize the care. No matter what you look like, no matter where you come from, we ask you the same medical intake forms, right? When we ask you the same questions. So when you look at Gloria, hey, like Gloria, you look like an executive. I don't have time now at the end of the visit. I'm not going to ask you about partner violence. Guess what? In asynchronous, you don't get a choice. Everybody get asked the same sets of standardized questions and standardized answers, and that's where standard of care is delivered because we ask you the same sets of questions and the patients doesn't matter where you are, doesn't matter what you look like, and that's really like the beauty of asynchronous.
Do you find that you do see patients who are from places that might have struggles getting equitable care in a traditional setting?
Yeah, definitely. Even things like reliable broadband, right? That it's not something you can count on everywhere in the country. And having a video connection is difficult. I mean, you must have been in Zoom calls where the other side had to drop off for one reason or another, right? With asynchronous, you break through all of those barriers because, like I said, right, you can take multiple sessions to complete your medical intake form. When if you have to drop off, let's say you're riding a bus and you leave the bus, you have no Wi-Fi, right? We remember where you are in a medical intake form. So when you log in, when you have Wi-Fi again, then you can complete the remaining questions, right? Same thing with messaging. You get the time to think about what you want to talk to the physician about, and that's really wonderful, especially for patients in slightly lower socioeconomical situations.
Wow. Well, I just feel like you're opening up a completely different way of taking care of people with this asynchronous, which you're clearly an expert on. As you would enjoy talking about it, I would probably enjoy listening about it. But let me pose a little bit a hypothetical question to you, or maybe it isn't so hypothetical. If it's all asynchronous and it's all based on messaging, can you ultimately, and it's all based on standardized questionnaires, could it just be Chat GPT in the background answering all these questions?
I do get this question quite a lot because my background is machine learning, data science, AI. I've written lots of code, built lots of recommendation systems in my past. I do think a good amount of the intake can be done, right? So when I think about intake, you're trying to find a way to extract the right amount of information from the patients, right? Whether you call that person up, whether you give them an intake form, whether you have a conversational AI with them, right? It doesn't matter to me. You're extracting the right amount of information, building trust with the patients. Fundamentally, I think it can be done in many different forms. Now, I think the difficulty really is when it comes to diagnosis, treatment plan, you need someone who's licensed. There is a lot of, just the risk, like insurance, all of that liability, right? You need a human in the middle for that part of the diagnosis and treatment plan. And you will, in the foreseeable, like 10 plus years in this country, I think in a regulatory environment, you will need a person in the middle for anything to do with treatment plan diagnoses. ChatGPT or other AI tools can assist in the collection of data, maybe in some of the clinical decision making, but you know as well as I do, Dr. Gupta, that any clinical decision making is going to take the FDA many, many, many years to really approve.
Fair enough, but augmented potentially, which would be really exciting because then with your idea of asynchronous plus combined with artificial intelligence that's really smart in collecting, potentially even at least laying out the initial treatment plan, now you can really expand the capacity of the workforce. That's what excites me about what you're talking about. It makes it accessible and it makes it inexpensive, but it also allows us to actually leverage this a workforce that's already pretty scant, right? So, to me, what you're opening up is a really brand new paradigm.
Yeah, definitely. I think there's a lot of potential. I think fundamentally it is about the efficiency, right? Which is why we're super affordable. And two, like don't forget that we want to build trust with the patients, right? So that is a huge part about this. That's why we employ a dedicated primary care model, the same provider, right? Building the trust and understanding that there is a human that you're accountable to behind the scenes. So I'm curious to see how that evolves in this new world with ChatGPT.
How do you form the personal relationships and have them actually feel like somebody's caring with them? Is it kind of like over a period of time, if you have a pen pal, that same type of thing, you just get to know them, mutual disclosure? How do you build that?
Yeah, that's a great question. And I talk about this, right? When I look at, like the kids nowadays, they don't pick up their phone. Like they only text if they go on Discord and talk to their friends, right? That's how they build relationships. And that's how we model how we build relationships with patients. And I think there are like little nuggets here and there that helps. So for example, we one experiment we ran and now we employ that on our platform, right? Is to ask the patient for a photo and we show them a provider's photo, right? So those little things really help because you see a patient holding onto a cat maybe, or like wearing a scrub and that's it. She's a nurse, right? So you have conversations that way. You get to know both the provider and the patients and you connect on those. And I think in the long run and in my ample free time, I want to do a proper study on asynchronous means building a relationship. Can you compare that to the traditional brick and mortar visit where you're really rushed and you don't often get to see the same person and the provider don't really have time to review your chart before you go in. So I want to do that comparison, I mean, in a very, very long run. But I do think that when you look at how kids utilize devices, right, like you definitely can build relationships over asynchronous means.
Wow, I would love to see that study once you perform it, Gloria. That does sound fascinating because I think the world is changing. I think you're right that ultimately the way in which we use our technology still allows us to build relationships. I know a lot of people worry that technology is fraying relationships, but I do think I agree with you that the way in which we use it and leverage it can be very helpful. So I guess I'll go a different tack now with my final question. You're outside the insurance model right now, Gloria, but I can easily imagine because of the work that you're doing, you were starting to allude to this earlier in our pre-interview that you're getting great outcomes, you're saving, costs. Do you think ultimately insurance companies will be willing to subsidize this cost on behalf of their members?
I think so. So our patients primarily comes from the consumer means, meaning they just walk in organically as a consumer, but we also have employer sponsor plans. So we have some employers who are working with us already and they sponsor this for their patients, right? For their employees, because it's very, very effective. It deflects a lot of costs and we have actual ROI analysis on this too. I do think insurance companies should start thinking about this and being creative on, especially bridging the gaps in hard to reach areas for patients who, like just don't live close to either PCP or OBGYN or anyone.
How does a patient know if finding an asynchronous primary care provider is for them? How do they know that that's really going to meet their needs and take care of the things that maybe they're putting off or that they don't want to ask somebody else?
Yeah, that's a great question. And I would say try it out, right? Like you try it out. We're very, very transparent. It's a monthly cost of $29 or $49. You can decide to cancel anytime or a la carte $35, right? Try it out, see if that's right for you. We have thousands of reviews. It's all public and it's 4 point something stars over 5. Our NPS is 70+%. And it's amazing. Like you can just read through reviews and understand whether this engagement model is right for you and try it out because it's very low cost and low commitment.
Thank you so much for being here and sharing with us this great information.
Thank you for having me.
It's such a delight. Thank you, Gloria.
And
Thank you.
thank you all
Bye.
for watching. We'll talk to you soon. Bye-bye.